Yeah.
And how did you get from Wisconsin to Sinai Hospital of Detroit?
Well, that's an interesting story. I think some people may be interested in the connection. I was looking for, after I'd been on the faculty for a few years at the University of Wisconsin, I was looking for the opportunity to lead a division in MFM. It's called Maternal Fetal Medicine. And I was approached by Dr. Milton Goldrath, who had a very good friend of his who worked at the University of Wisconsin. His name was Dr. Ed Ehrlich. Dr. Ed Ehrlich was in the Department of Nephrology, Kidney Diseases. He and I knew each other. He knew I wanted to leave. He contacted Milton, and Milton came to see me and said, "Why don't you come and have a look at a position we have open at Sinai Hospital of Detroit?" So I visited here and found that there was a very warm and welcoming group of people. Milton and his wife, Joan, were very good to me, as was Alfie Sherman and his wife, Sandy. They were the two of the leading physicians in the department, and they encouraged me to come here. So I visited here a few times, saw other people like Dr. Seymour Ziegelman and Loretta, Jerry Weinberg and Didi, so the people whose name may be familiar to people here. But it was a big department, and it was a well-developed department. It had a great reputation. I think one of the reasons I came here to this sort of hospital was because in this country, you had a range of hospitals that was not available outside of the country. You have hospitals that are purely run by universities or state or public systems, and then you have private hospitals. And some of the private hospitals, such as Sinai of Detroit, were affiliated with the universities, had their own independent residency, so there was the educational piece as well as the academic piece and the private practice piece all merged together. So it was
Did you explore other other hospitals before you made the decision to go to Sinai? I know you just said Henry Ford.
Well, I didn't because I felt comfortable at Sinai. My friends were going to be going there. It was like a fraternal organization.
Was the fact that there were so many Jewish doctors, did that play into your decision?
I think it did. I don't think it was the doctors as much as the environment. Everything about it was what it made me feel comfortable.
Talk about the environment. What was it like?
Well, they had rabbis. They had kosher kitchen. It was a very friendly hospital. It was small enough to be friendly and big enough to be good. And we worked very hard. The quality of care was very good. And our residents were all very comfortable with one another. There was a lot of kibitzing there, and we had fun.
So the Jewish doctors, that was a dynamic. But what about the non-Jewish doctors who were there? Did they feel comfortable in the environment?
100%. Yeah, they were loyal to the hospital, and there was, in those days, those non-Jew, a lot of them were surgeons. The surgical group had a lot more than the medical. I was internal medicine, and it was the surgeons that had a much larger number of non-Jewish doctors. But I was very comfortable with everybody.
Did you ever think about going to another hospital in your time at Sinai?
Never. Did not. I was so involved and so grateful to be there that, no, never. When I thought something like in that line was after close to finishing the residency to see if I would do a fellowship in something else. But I knew I wanted to do general surgery.
How did the hospital change, in your opinion, from the time you started working there until the end, in terms of its evolution and the quality of care, medical innovation, et cetera, et cetera? I'm curious what you think.
Yeah, when it took me probably a couple of years or so to appreciate what the hospital has to offer and was offering me and everybody else. The quality of care, the compassion, the knowledge, the talent that was there. But as we neared the I would say, the end period where Jewish patients started to migrate, excuse me, to other hospitals in the suburbs. We started to decline in revenue. And that became, that was very, there was a shadow that was growing, and it was sad, but the quality of care did not suffer.
So let's start at the beginning. Where and when were you born?
Baltimore, Maryland, April 25th, 1923.
Let me do the math.
It wasn't so easy to get rotating internships. Most of the Jewish kids went to Jewish-sponsored hospitals.
Were there many in Baltimore? Or
There's only one in Baltimore. It started out to be known as the Hebrew Hospital, but then they changed the name.
Sinai became known as a preeminent teaching hospital.
Absolutely, absolutely. After we got our full-time chiefs in there and we developed our training programs, I would say that Sinai Hospital, you see, before Sinai Hospital was sort of junior brother to places like Harper and Henry Ford. But I can tell you, when we reached our peak, you know, and that would have been in the 60s, 70s, you know, we were the most academically oriented hospital in Detroit.
It was, you know, I've been told it was a very innovative hospital too. That there were lots of programs that evolved out of Sinai Hospital. And
Yes.
so
yes.
talk a little bit about the kinds of things that were established
Well,
at
first
Sinai.
place, we had good research done at the hospital. We had a chief of research, Pierre Foa, who was head of research there, and he stimulated a lot of publications that came out so that all of us developed in our own specialties. We all became involved academically, associated with the university. There were many publications that came out of Sinai Hospital, and there was a lot of good work.
So in 1980, when I first started, I knew the history of Sinai. Somehow my parents told me the story about how Sinai was established because Jewish doctors didn't have a place to practice. And I was blown away that in my lifetime, Jewish doctors could not get on staff at hospitals. It was just unrealistic to me, yet that was reality. So I always had a sense of the history of Sinai Hospital from the Jewish background of it.
You didn't have any problems at your career stage going to other
No,
hospitals?
because in 1980 already, that was not an issue, yes.
Did that history have impact on you when you went to the hospital?
Oh, definitely. I think
Tell me a little bit about it.
Well-
And some of the Jewish doctors who came to Sinai for that very reason.
Right. Well, I always appreciated the historical reason for it, and it made me respectful of what Sinai Hospital means to a community. So back in those days, there were a lot of Jewish doctors, obviously, at Sinai Hospital, so I really got to interact with some amazing people.
How did Sinai change between the time you started and the time of the sale?
Well, over the years, the Sinai continued to invest in its infrastructure, remodeling the emergency room, redoing the operating rooms, creating new wings, moving the library, making the library better, hiring people that were interested in basic research. And then economics began to take a hold on the hospital, and they couldn't go forward. So there came a time where the hospital was just doing its best to stay there. I'm sure if it just stayed there, it wouldn't have worked out, because economics for hospital systems, single hospitals, is not working out in America today. So we see mega mergers. We see now Henry Ford Hospital emerging with Ascension, and we see for-profit hospitals in Michigan, which probably was, in retrospect, was not a very good idea. So things changed gradually, mainly because of economic issues, but the basic principle of the hospital stayed for all those years: education, research, quality care, commitment to the Jewish community, commitment to the Detroit community.
How and when did you become involved with the Sinai Medical Foundation?
The Sinai Medical Foundation was established right after Sinai closed. Maybe in 2000, the Sinai closed in 1999. There was a Sinai education fund that took care of indigent patients or patients in the Schiffman Clinic. And the doctors agreed not to collect those monies for themselves. They were manned by attending physicians and interns or residents. But there was a certain amount of money that was paid by the government to take care of these patients, and they did not take those fees. I believe sometimes there might have been some insurance that was involved, but again, they didn't take those fees. And so there was an amount of money that was collected, and the doctors that were involved in the education fund decided to keep that fund out of the sale. I mean, it wasn't part of the sale. And they developed the Sinai Medical Education Fund, not Sinai Medical Fund. And that fund was to do several things. To encourage medical students to be able to continue with their medical studies, or at least to help them out. So there was scholarships that were made available to different medical schools. At the time that it was established, there was two medical schools, University of Michigan and Wayne State, and then there was also, I'm not sure the time that this occurred, it might have been near the beginning, there was Michigan State School of Medicine, and then Michigan State School of Osteopathy. We contribute about $250,000 to the three schools, the medical schools, each one, and that money was used, as I said, to help medical students pay for their education. We also had a philosophy about giving research projects money. And so it could range for anywhere from $5,000 or even less sometimes, up to $250,000. So there were some projects that we invested in extensively, one of which was with a neuro department in the University of Michigan. And also there were other research projects that people would apply for, and that we would consider and decide whether we wanted to give money to that. And then there were some community projects that occurred. So in helping somebody establish a medical clinic, or service a different or a certain type of population. So we contributed money to that. Interestingly enough, I'm not sure this is totally accurate. I think we started out with $2.5 million. The fund started off. We've given millions away. And now the fund is worth about $5 million. After giving that money away, and through investment and things like that, the fund has increased. And when it increased, we were able to give more funds away. There was a certain requirement by the government that you had to give a certain amount of money based on the worth of the fund. And sometimes we exceeded that because we were able to do that. But most of the time we met that number, and we would meet to decide what we wanted to contribute to. And we asked them for documentation and to have feedback relative to what they were doing with the money. When we gave money away, we asked them for some sort of recommendation to the fund. So it was pretty extensive that one, we gave money away, and two, that we got recognition from it. And also the medical students every year write a letter of thanks to the fund for contributing this money.
Is there anything else that you would like to discuss that you haven't mentioned yet?
Well, you know, you asked me about the culture of Sinai, and the culture at Sinai was what I said it was, but this extended to the nursing staff, to the non-nursing staff, to the kitchen, to the janitorial staff. I mean, all these people had a feeling about Sinai, much like the feeling that I had. I had some patients after Sinai closed, many years after Sinai closed. We used to talk about Sinai. And everything they said is, I miss Sinai. They went to different hospitals. Some of them said, never the same. So there was this atmosphere that everybody, for lack of a better term, bought into and recognized, that produced like a family type atmosphere, and people wanted to come to work and do their work well, whether it was a doctor, attending staff, employed staff, or nurses, or other staff. And everybody, I mean, there were tears when Sinai closed. And so, and that feeling went on. And I've never experienced that feeling in other hospitals. Maybe that I didn't grow up there or whatever, but it's not the same. And also, a feeling of being in a Jewish hospital was very important.
So how did you find Sinai when you, the environment there when you?
It was amazing. It was unlike any hospital I had ever been in.
Give me a description.
Mostly because it was comfortable, it was friendly, and yet it was really academic. These were outstanding physicians, but the collegiality was unlike anything. And I had been in a lot of hospitals at that point, between the two residencies and rotating through different institutions. And I have to say, since that time, I find it the same, because I've been at other institutions. It was just a very welcoming environment.
Was there a Jewish factor in that?
Great, unbelievable Jewish factor in that. Being able to feel comfortable with my Judaism, which was an important part of my life. It was just very welcoming. It was a great work environment.
Now you explored other possibilities around the country before you came
I
to...
did.
Did you find any issues of your Jewish identity when you went?
Not overtly. Not overtly.
Could you sense anything?
At that point when I was looking, I think there was a sense that it wasn't, well, let's just say it wasn't as welcoming, and I wasn't as comfortable as I was at Sinai. And certainly my own experience just through residencies and trying to get holidays off, Jewish holidays, was always a challenge. Not so at Sinai.
Now, I've been told that Sinai Hospital, at its height in terms of Jewishness, there were about 65% Jewish doctors. And how did the non-Jewish staff feel about working in an environment with 65% Jewish doctors?
Well, I think it was just a very welcoming environment, generally. Jewish, not Jewish, it was a very It was still high-level medicine was practiced there. I think it was also unique in that not only were physicians collegial, they were even more than that. They were friends. I can tell you, in most institutions I was at, if you'd go to the lunchroom, you wound up sitting with the same group of people in your department. Not so at Sinai. You walk in, you were comfortable anywhere, and you sat with people that worked in multiple departments.
Still friends with some of these guys?
Sure am.
And gals?
I sure am. To this day.
Now, you said that your dad said you should come and explore. What role did he play in making you make the decision to come and stay?
Well, I think the fact that I got a chance to work with him, and that was really appealing to me.
How was
that? To be here. Oh, it was fantastic. Not only did I learn a great deal from him in terms of just general anesthesiology, because while I did go do an anesthesia residency to practice critical care medicine, funny thing happened along the way. I really enjoyed anesthesiology. So while I did practice critical care exclusively, probably for about 10 years, I eventually came back to anesthesiology. And I learned a great deal of that field, but also about administration from him. And it was just a great opportunity for me. And I'm delighted, never regretted it a day that I was able to work in the hospital with him and my brother.
Very fortunate.
And very fortunate.
Let me ask you, when did you find out that Sinai was going to be sold?
Well, interestingly, at that point, my father had retired, and I had assumed the position as chairman of the Department of Anesthesiology. And so this was now in the early mid-90s, and that's when we started to learn about the possibility of the sale of Sinai. At that point, I think most of us came to recognize that the day of the independent hospital was coming to an end, that most institutions needed to become part of a larger healthcare system in order to survive, and that the number of healthcare systems were, even those were going to be limited. So it became a little challenging at that time because I think everybody saw the writing on the wall.
You know, it was, I'm editorializing here, so you'll forgive me. It was a demographic issue.
Clearly.
The Jewish community was no longer coming to Sinai Hospital anymore. Or,
I think that's absolutely true.
and there are some who I've spoken with and said, we made a mistake by not building, you know, out in the West Bloomfield area. How do you feel about that?
Well, I have a unique perspective on that because when Sinai closed, I went to Henry Ford.
Well,
And there was discussion between Henry Ford and
Exactly.
Sinai about being in West Bloomfield. So of course, that would have been ideal for me. And I would have loved to have seen something like that. And to continue Sinai in that form would have been, I think, just a great opportunity. Sadly, that didn't happen.
anything else that you can think of that you'd like to add for the record that we haven't discussed?
No, I'm delighted that this project's moving forward. It's such a unique, and it was a unique institution. And I think, and I hope you're getting that sense from everybody that you've had a chance
Absolutely.
to talk to. It is, and we all bemoan the fact that we don't have it, but are so grateful that we did.
And I think probably another uniqueness I'm editorializing is the foundation. The fact is that we took the funds from the sale and have created an instrument that does extraordinarily good things in the community. And the Sinai name will continue, which is, I think, very important.
And it also gives some of us that were on the staff a chance to still get together.
Exactly right.
And be together.
Yeah.
So it's really been wonderful. So thank you.
Thank you. It's been a pleasure. I'm kind of interested in when you got you sort of alluded to it, but I want to understand the camaraderie that you experienced at Sinai, and being Jewish, how that factored into obviously your decision to come to Sinai.
Let me answer the question about the camaraderie and being Jewish, because of course they're interrelated, right? They're basically interfused. One of the things, and one of the answers I gave to people who asked me at my last year in Minnesota is why I was coming back to Detroit was because of Sinai Hospital. They asked why. I said it's a very, very unique hospital. It was academic. We had to do a lot of academic research in internal medicine. The chairmen and chiefs of the departments were academic, but they also were personable. I remember seeing Herb Ravin, who's the chairman of the Department of Internal Medicine, when I applied to Sinai, and the vice chair was a gentleman named Charlie McCune, who was a Harvard-trained internal medicine specialist who was in charge of education. And all the chairmen of all the departments, although they were tough guys and were good administrators, you always got the feeling that they cared about you as an individual, not just as a physician or as a cog in the machine. That was way more prevalent at Sinai. Not to say it wasn't also prevalent at university settings, but not as pervasive. So there was a feeling of brotherhood at Sinai, whether you were Jewish or not. It was a very diverse residency program. I would say that maybe 60 or 70% of the residents at that time were Jewish, but there were plenty of residents from Europe and South America who we all got along with famously well, who were very bright guys. And so the Jewish principles of tzedakah and giving back to the community, academic stimulation, and caring for people, most importantly caring for people, was instilled and imbued into all the residents from all the attending staffs and all the chairmen. Not something that I found as pervasive at the university settings, and that's the difference.
Yeah, that was you factored in my next question, but I'm curious, there were clearly Jewish doctors at some of the other hospitals in the community. How was their experience perhaps different than being at Sinai and being Jewish? I'm sure you had colleagues and friends.
Yeah, I mean, there were Jewish doctors at Mount Carmel when it existed, at Beaumont, of course, at Providence, downtown at DMC, and the chairman of our department at DMC was associate professor with Bob Lysak, who was Jewish. He's a neuroimmunologist. He's still alive. A great doctor, wonderful guy. Those individuals were warm individuals. You could have plenty of non-Jewish heads of departments who are also very warm individuals as well, but it wasn't the proportion. It wasn't the density. And one got the feeling that if something happened, you could always count on the guys at Sinai, whereas if you're an individual, whether you're Jewish or not, at other institutions, you weren't sure you could count on them because they had to perhaps ask advice or permission from someone else who may or may not have been Jewish, who wasn't imbued with the same sense of commonality that we had. It had a certain tum is the best word. It had a certain tum to it that was sadly lost when it was sold. All of us felt rejected in some ways, dismissed in some ways, and disappointed in some ways.
So the hospital was sunsetted, but the foundation was created.
It was.
How do you feel about that?
I think it's great.
Tell me the role that you played in it, or are continuing to play for that matter.
Well, I was an initial member of the foundation, but about 3 years ago or so, maybe a little longer, I was out for dinner with, I'm blocking the name because of my age, I'll think of it in a second.
Welcome to my world.
And he mentioned that he was on the foundation and, they're looking for people. He wasn't cultivating me particularly, but I cultivated that, so I would like to join. And so he put my name for nomination. I became a member of the foundation. Now, I missed a few meetings because of medical issues, but I think it's a wonderful. It serves a very useful purpose, a multi-dimensional purpose. One, it keeps Sinai and the legacy of Sinai alive. Two, it distributes funds from the Sinai Foundation to worthwhile institutions, whether they're Jewish or whether they're not Jewish. It doesn't matter, and they're all treated equally. So it shows the community that we're philanthropic medically, and that we continue to do so. Because after all, that's giving back to the community is one of the foundations of Judaism, really, right?
Correct.
So that's what Sinai Hospital represented, and that's what the legacy should be going forward as well.
And you're happy with the kinds of decisions that the foundation has made over the years?
I think so. Now, I'm not aware of the foundations from 15 or 20 years ago, but I am in the last several years, and yes, I am.
So tell me, just mention a couple of the things that you funded while you've been
Well, they're
on
still
the
up.
committee.
In fact, they had a meeting in October, which I unfortunately missed again. But we have, to give you an idea, we have grants going to, or evaluating grants from Ford Hospital, Providence Hospital for their different areas of expertise. One's for Alzheimer's disease, one's for cultivating the community around them to make health issues more accessible on a non-medical basis, organizational issues. We fund grants for the evaluation of dialysis and so forth. So they're medical as well as cultural grants that we fund. Some we turn down because they're redundant or we don't think they're as important as other ones as well. But everybody gets a fair shake, and everybody on the board votes.
Anything we haven't covered, Bill, that you'd like to address in our closing moments?
No, I'm sad that Sinai isn't around. We all used to call ourselves the diaspora, the Jewish diaspora, the Sinai diaspora. Well, we had a get-together at a golf club about 10 or 12 years ago, and there were hundreds of physicians there, and we all were sad, but we all were happy to be together. So I enjoyed this interview.
As have I. It's been a pleasure.
Yeah, and I'm so happy I came back to Sinai Hospital.
As are we.
Well, thank you. Thank you.
Thank you very much for your time.
You're welcome.
It's very
My pleasure.
greatly appreciated.
My pleasure. Thank you.
I graduated Wayne State, did internal medicine residency. That's when I went to Sinai from 1982 to 1985. I decided not to specialize because, again, I wanted to do primary care. So after 1985, I went into practice. But my years at Sinai really trained me well for what I wanted to do.
And a little bit about your experiences in your residency at Sinai. Is that where you first got to know about the hospital? Was that your first real intimate experience?
During medical school.
How was your relationship in medical school with Sinai?
I did some rotations at Sinai. I think my first rotation was internal medicine my fourth year. The doctor in charge of us was Charlie McEwen. I'm sure you heard plenty about from your other interviewees, and he really mentored us. You know, he didn't practice medicine, but he oversaw all the students and the residents, and really he was like a fatherly figure to us. Remember, he would take, as a medical student, he would take me canoeing. He loved canoeing. Take us to his house, and he was like the father hen to all of us, and took a lot of pride in that.
How many people were sort of in your class at the time?
At Sinai?
Yeah.
So our internal medicine residency class, I would say about 12 to 15 people.
And he took all of these people under his wing?
Yeah, exactly. And when we were deciding as Wayne medical students what to do, and a bunch of us wanted to do internal medicine, we were all very close, and we all pretty much got together and chose Sinai. When I interviewed with the chairman of internal medicine at Wayne State, and he was a very academic person, not even from Detroit. He said, "You can go wherever you want. I'll get you wherever you want. I'll get you to Duke, to Stanford. Tell me where you want to go." And I said, "I want to go to Sinai." And he had a hard time understanding that.
That's interesting.
But as my experience as a medical student there, I just knew that was right for
Now,
me.
did you do rotations at any other hospitals in the area, or was it just on Sinai?
As a medical student, I did.
I'm saying,
Right,
which
yeah.
other hospitals?
All the DMC hospitals, Harper, Hutzel,
And give me
Detroit
Give
Receiving.
me a comparison between Sinai and those.
So third year was all at the Detroit hospitals, Detroit Medical Center hospitals through Wayne State. And they were wonderful doctors, they were wonderful people. But once I did that first rotation, fourth year at Sinai, I think it was August of my fourth year, it was homey. The doctors were Hamisha. They really cared a lot about you. I'm not downgrading any of the other doctors I had experience with at DMC, but it was just a different feeling. You could tell it was more of a family atmosphere. And I really took to it, as did many of my other co-medical students who wanted to go into internal medicine. So we had a great internal medicine class at Sinai the 3 years we were there.
All Jewish?
I would say 80–90%.
Yeah. You know, I've experienced with others, so I'm going to ask you the same question. The fact that you were Jewish in a Jewish hospital made other doctors feel very comfortable. But I asked them about the non-Jewish doctors at the Jewish hospital. And what was I'm going to ask you the same
it was
question.
fine. I mean, they were part of the same family, basically. And I don't think they felt like fish out of water there whatsoever. Definitely not.
Yeah, it wasn't true the other way around in some of the other hospitals. Right?
Probably true.
Yeah.
Right.
So a little more about your experience. So talk about the residency and what you did and how
So it was internal medicine residency. It's certainly very difficult. You had call every fourth night where often would be up all night taking care of people during the nighttime hours. Every month we switched rotations from working on the floors to emergency room to some specialties. So we met, of course, the whole plethora of doctors who were on staff at Sinai that way. And pretty much across the board, I just have such fond memories of so many of them. And they really cared about you. They weren't intimidating in a negative way. You really felt like you wanted to learn from them. You would suck up everything that they would want to teach you. And it really was not only the academics of medicine, but how to be a doctor, how to treat people, how to talk to people. And they all really seemed to enjoy what they did.
When did you first hear about Sinai Hospital?
When I was growing up, Sinai was one of the prime hospitals for everyone in our community.
Were you ever treated at Sinai growing up, or any of your family?
My family I was not, but I knew some of the classmates that were a little older than my age that became interns and residents at Sinai, and they had very good things to say about it. And that also, I think, convinced me that that would be the place to go for my training after medical school. At med school, I took the 4-year program. I went and then became an intern at Sinai Hospital of Detroit. After a year of internship in those days, we went on to residency program. And I spent 3 years in ophthalmology residency at Sinai also, which I believed was at that time probably one of the best ophthalmology residencies at the time.
So talk about that a little bit. What was your experience in the ophthalmology?
It was really interesting because when I entered the program, there was one resident in each year. There's a 3-year residency program. And we learned a lot from the attending staff. They were very, very instrumental in teaching us all aspects of ophthalmology. But at the time, there were no subspecialists. It was all general ophthalmology. Cataract surgery, muscle surgery on pediatric patients. But I became interested in retina, which is the subspecialty I trained in, because Sal Sugar, who was our chief at the time, who was a glaucoma expert, but also very well trained in ophthalmic photography and pathology, and even did corneal surgery. He did a lot of things and got me interested in the retina part of it because he had a camera that took photos of the retina, which nobody else had at those times. During my years at the program, we added all types of equipment at the eye clinic to increase the retinal surgery department there. And we learned a lot about all of the newest aspects in retinal surgery.
Who designed these kinds of things? These sounds like groundbreaking inventions,
It's
really.
interesting. When I started the residency, there was no lens implant surgery. There was no laser treatment. We were doing photographs of the retina before anybody else had a camera in their office. We were doing ultrasound tests. No one else had an ultrasound machine. We were doing all types of advanced things, and there was also a research building at the time, and we were doing some eye research with laser treatments.
So it sounds to me like that Sinai was a groundbreaking department. Did you have hospitals that came from other places to learn from you?
We had some rotations from Wayne State residents, but primarily it was our advances through our residency. Some of it was reported at the Academy of Ophthalmology meetings. Some of it was published. Saul Sugar, our chief, wanted us to write a publication every year, one paper every year. And also we had posters and other publications that we created while we were there. And a lot of the advances in the ophthalmology program developed when I came back from my fellowship in retina. I did my fellowship at the University of Wisconsin. I came back to the Sinai program, and then I began teaching all of the things that I learned in my fellowship. We got a laser at Sinai before anybody else really had a laser, and we thought the laser would cure all retina problems. So after the residency, or the fellowship, I brought some of that back to the Sinai clinic. And then we started teaching all of these other aspects of retinal department. Some of it involved a new laser, and some of it was developed actually in the research building. And when we got some of these lasers, we had a variety of types. We had argon, krypton, we had the infrared lasers that were used for LASIK and for some glaucoma procedures. And all these were kind of pushing the frontiers, I guess I would say, because hardly any other places had these types of laser equipment. Also, we brought vitreous surgery. An operating microscope was placed in the operating room. I don't think very many surgeons were using a microscope to do their cataract procedure. And we had that set up. We also had a low vision clinic at Sinai's clinic.
So talk about your residency. Give me accounts of how the residency was when you were there.
Having grown up in Detroit, when I finished medical school, I kind of said, well, okay, time to move on. And I went to Chicago for a year at University of Illinois, and didn't really make it, didn't like it there.
Because?
Well, I really enjoyed the leader of the program, but the day we got there, he said, well, by the way, I'm leaving next month. So I said, oh, maybe I don't want the new guy. And so I looked and went back to Sinai right after my internship to start my residency, and then I never left for 12 years.
Obviously Sinai was unique in the fact that many of the doctors and residents were Jewish, and I'm interested how that impacted on how you evolved and did your business. And also related to, you said that you went to some other hospitals to do residencies too. Was there a difference doing your residency at Sinai and doing it at some of the other hospitals?
Well, the other hospital I was in was the University Hospital in Chicago, and it was an academic institution, and the faculty were mostly professors. And then you come to Sinai, and there are no professors there. There are practicing doctors. And to me, the unique thing about Sinai was that here it is, a community hospital, teaching medical students, residents, fellows in lots of different areas, all done by community-based physicians that are in clinical practice. And to me, that's what I wanted to do, learn clinical medicine. It was a wonderful, wonderful opportunity. There were very dedicated physicians there who pretty much gave of their time. The way they could potentially be paid was by taking care of indigent patients. And they said, no, we're not going to take that money. We're going to give it to the Sinai Education Fund. And that's where the Sinai Medical Staff Foundation actually came from the monies that the doctors earned and donated,
right,
basically. But they were very devoted. I remember they gave up their time generously and completely, and it was a wonderful education. The camaraderie amongst the staff. They weren't only, I'm sorry, the residents there, the other interns and residents were from all over the world. I had a good friend from Oregon, I had another friend from India, and a lot of other Jewish friends. A couple of the people I went to medical school with also were in the same program with me. In fact, one of whom I ended up becoming partners with when we went into practice. It was a good experience.
My chief, John Helfrich was his name, knew some people in West Virginia who were quite good. So why don't you give these people a call? And I did. And I wound up going to West Virginia, and I was the director of the oral surgery program they were trying to create at Marshall University in Huntington, West Virginia. And I was also in private practice there for 6 years. Going into the 6th year, John Helfrich left in 1984. There was a void. There was a temporary chief for 15 or 18 months in between him and me. And one of our attendings, a guy named Erwin Small, suggested that maybe I would be a good choice to come back as be the chair. And my big supporters to come back were actually Erwin Small and Eli Brown and a few other people working behind the scenes, whom I didn't even know were working on my behalf. So I came back to Sinai as the chairman in October of 1985. So I was in between, I was in West Virginia for 6 years. And I couldn't wait to get back to Sinai. That was a dream. So the shift had commenced in the 1970s of changing from the old classical 3-year residency that basically did trauma and took out teeth all day long into a real hospital service like ENT would be or plastic surgery. Very, very similar. And in fact, Sinai actually was a 4-year program in the 1960s, and it didn't become the standard until the 1980s. Wonderful thing about Sinai. You just had to be recognized for how you did your work. It didn't matter where you came from, what you looked like, or what your degree was. You just had to be on top of it. And that's what it was. We continued to at least attempt to do the research piece. So I have to go back a bit to a question you're probably going to ask me later about research. Sinai was absolutely extraordinary as a private, non-university hospital to have its own research wing. We had a building. It was the research building. It was run originally in my time by Piero Foa, who was originally from Milano, from Italy. It's a dual degree guy, MD, PhD, outstanding researcher, and I believe that glucagon was, his area was in diabetes. And we had this hospital research building. Adrian Kantrowitz had a lab there. His left ventricular assist device was developed at the research building at Sinai Hospital. So we had this wonderful research activity that was really high level. Quite a few papers were published, a lot of awards were received, and it was a really wonderful thing. And when that went away with the hospital, I think the whole tenor of the hospital changed somewhat. It made a private hospital much more like an academic institution that's doing really great clinical care. And that's a very hard combination to achieve. It's even difficult to achieve in a university, in my opinion. We had our goal, the single requirement to come to Sinai wasn't being Jewish. It was, you know why the hospital was created. I won't go over all of that. So it was a comfortable place where no one was going to kick you out or find some fake reason to eliminate you because you were Jewish. We didn't have that to worry about. But we took people from all over the place, a lot of whom, the majority of whom at that time were Jewish. But they were from everywhere. And some of my best friends and colleagues, and really exemplars of how to do good medicine. Leo Eisenberg, Eduardo Phillips, they came from Mexico. They were the best people you could ever imagine in what they were doing and how they conducted themselves as human beings. It was a great example. And we had other colleagues who were from India, Iran, Israel, the Malinowskis from Poland, doing fellowships. One fellow from Indonesia who became a GI